Welcome back to movementprofessional.com. So this video is going to be in response to, I got a message from a friend of mine from high school. He's a barber now. He said that he's getting some symptoms similar to shoulder impingement, or that's what at least somebody told him. So I haven't fully evaluated him, so I'm not really sure. I'm not going to go based on diagnosis. But it just brought up a bigger point of, what do you do with a presentation like a shoulder impingement, and also more importantly, for those who are working like a barber where you have to be unilateral using one arm for a long period of time, and there's going to be a lot of forward reaching. So you can think about many other professions, just using computer work, using a mouse frequently. Dentists is something I frequently see, or dental hygienists, where they're often in asymmetrical positions with one arm reaching forward. So any of those professions where the arm is coming forward for a long period of time, what's going to happen to the shoulder? How does that lead to injury? And then also, what are some of the things we can do to balance that out to prevent the injury from happening? So the most important thing is thinking about what an impingement of the shoulder is. It's not really a specific diagnosis. All it really means is that you have your shoulder blade, which has a little bit of a ridge on top, and something called the acromion, which is kind of like the roof of this, it's called the subacromial space, and then you got the ball of your arm bone or your humerus, and that makes the floor of this subacromial space. And in between those two spaces, or in between those two bony prominences, you have this area where a lot of structures are, and they kind of get sandwiched in there. So one of them is the supraspinatus tendon, which is a rotator cuff, the most commonly injured rotator cuff, just because it is sandwiched in between those two bones. You also have some bursa, which are just these sacs that are supposed to be there to decrease friction between two bony surfaces. Sometimes that gets irritated. You get the bicep tendon, which you think of the bicep right here, but it actually comes up to the front of the shoulder and then attaches to the glenoid, which is the socket of the shoulder. That can get impinged in there. So all these structures can get pinched, and most of the time it's not just one, it's all of them. All right, so that's just kind of the general mechanism, but really it's what we're doing throughout the course of the day that leads to that. And oftentimes it's not one specific incident, but it's a buildup of just like a micro trauma or these imbalances of the shoulder that happen over time. So all of us are naturally one-sided. We have a right side dominant or a left side dominant. So if we're doing an activity where we're in a profession where we're using our arms a lot, we're going to be asymmetrical in how we use that typically. All right, so that's one thing to think about, is that we just always want to be understanding movements we're doing throughout the course of the day, and then understand what's the opposite, what's the counterbalance for that. So reaching forward is going to tend to lead to an elevation of the shoulder. All right, so the shoulder is going to get closer to the ear, and then also a forward tipping of the shoulder. So if we think of right here being this arm bone, this ball of the ball and socket joint, that's coming forward, and it's also coming up. So in the back here, the shoulder blade is going to slide up the rib cage, and actually the bottom part of the shoulder blade is going to usually tip out. So the muscles in the front of the chest here, and a muscle called your pectoralis minor, tends to get tight, and that pulls on the front of the shoulder blade is actually right under the collarbone here, called your coracoid process, and that will tip everything forward. So you end up walking around not even realizing it with an asymmetry here where one shoulder is a little bit tipped forward. So I'm exaggerating here, but really we're starting in a deficit most of the time on one side more than the other. One of the good ways to test this is to just do one arm up this way and just see how close you can get your fingers or your fists, and then compare it to the other side. Most people, myself included, are asymmetrical with this just because we're doing more reaching with one hand versus the other. And it's typically the shoulder that is your dominant side is more limited in the reaching behind the back because we're tipped forward to begin with. All right, so that's just real quick the general mechanism there. What do we do about it? That's more important. All right, so there's a lot of things. The bottom line is we want to just be getting the shoulder down and back as much as possible. So real simple stuff is always brace the core so you don't compensate by overextending and just squeezing the shoulder blades down and back. And it's important to do this often, frequently, low duration. You don't want to do this for a long period of time. You don't have to hang out here for too long, but just come to these repetitions, maybe 10 reps at a time, every hour, every half hour, depending on how much you're using your arm, just to often counterbalance. All right, so if you're a barber and you're doing a haircut, you're not going to want to break up the monotony of what you're doing. You want to really be focused on who you're working with, but right afterwards you should be doing a lot of stuff going in the opposite direction. So we can also flip the palms up, open the chest as much as possible, and really just be conscious of what's happening down lower here so we're not overextending. Alright, so this is an exercise here, opening up through here is an exercise, and then even getting a band and just having, you know, a rubber band, these TheraBands, this is just a TheraTube, and being able to stretch that out and go behind, always turn the thumbs behind, always brace the core, alright, and repeating that for about 10 repetitions every now and then. That could just be a nice simple exercise to counterbalance all that forward reaching. If this in itself right now is painful, then don't do it. I mean, that should go without saying. You don't want to go into pain right now. It's a good preventative exercise. If it's painful now, we got to find something else that isn't painful. You may be better off going down below so you're not going through this impingement position. Alright, so some other things to work on are the whole complex coming forward tends to lead the upper back to go into flexion. So getting either 2 tennis balls and taping them together and putting right between the shoulder blades. Initially, this is going to be pretty brutal if you haven't done it before. So just laying here, having the elbows in. This hand behind head position is really beneficial to get you out of that forward shoulder position so we can hang out there. And then once you get more comfortable with it, you bridge up and down. Alright, now you're mobilizing that upper back, which is not directly working on the shoulder, but it's working on the position to get you out of that forward shoulder position and elevated position. Alright, so about 10 to 20 pulses here. Alright, you can, if you have time, spend about 2 minutes. If you have to do this quickly in between clients, then just hop on here, do about 10 to 20, and it still should open you up. You may get a little bit of a pop and crack in the upper back, and that's not necessarily the goal, but it can be a benefit there. Alright, if you want to be more looking at one side at a time, you just take a single ball on the inside of the shoulder blade, and you can do the same thing one side at a time. Alright, you can actually go into some of the movements you might be doing, but just biasing, getting that shoulder back. Alright, so that's going to be right on the inside of your shoulder blade here that you would want to put the ball. Alright, from there, the other areas that get elevated, again, are up here by the upper trap and some of the muscles that go up into the neck. So one of the ways to work on that is getting a broomstick or some type of stick, finding a corner, jamming this into the first rib and some of the other areas up there, and just bridging up into it. And that will help to bring all that junk down and also release some of that muscle that's going to be pulling up towards the ear. About 10 to 20 bridges there. Alright, if you don't have any of that equipment, just using a chair, again, this hand behind back position can be really helpful. You got the chair just right in the middle of the upper back, just leaning back here, opening up the elbows as much as you can tolerate, don't go into pain, chin tucked, bracing the core, coming in and out of that can be very helpful. Again, do this routinely. It's not going to be magic if you just do it once here and there, but if you're constantly doing it to balance out all the forward motion throughout the course of the day, it can be very helpful. Alright, and then last thing, and I've done this in many videos, but just if you have the access to a post at home and a band like this, just doubling up the shoulder, getting yourself in a suspended position. Now you're pulling that shoulder down and back, and you can also angle it so it's coming downward, not just back. Alright, now you can actually go through some of the movements you would be doing, reaching across, alright, and just sort of emulate the activities you'd be doing throughout the course of the day, and then really just bias going back into the other direction. So you can really set your shoulder in a good position. You can get the neck involved trying to drop everything down. Alright, so as much time as you have there, you can do it for reps 10 to 20 times, or about 2 minutes worth. Retest your motion, make sure that the pain is either less, or you can go through more of a range of motion before the onset of pain, and certainly don't work into pain. Alright, so this is just a general discussion about impingement. No two people have the exact same symptoms, regardless of what the diagnosis is. And as a therapist, we're not really even treating diagnosis, we're treating the mechanism. We're trying to put people in better positions so that they have less risk of having some of these these diagnoses that come about. So, alright, this is not going to fit for everybody, but it's stuff to try. If you're really not sure, not comfortable with it, go see a movement professional. See you next time.